All right, welcome to Facebook Live with the Medical Association of the State of Alabama. My name is Aruna. I'm the president of the Medical Association. I am really excited today to have three guests. Of course, we always have Dr. Harris, our state health officer. This session is about schools and an update on our children. And so we also have the privilege of having Dr. Mackey, our state school superintendent for Alabama, as well as Dr. Karen Landers, who is the assistant state public health officer, as well as the Madison County public health officer and a pediatrician. So welcome. Dr. Harris, if you want to go ahead with the update.
Sure, absolutely. Thank you very much, Dr. Arora. It's good to be with you all again. This is about the fifth or so week, I think, that we've had these calls. We are going to continue to have them every Thursday afternoon at 4 o'clock. And so we encourage you to keep joining. Please feel free to enter your questions as well. We really appreciate this venue. It's a great time to hear from folks in the public, and we have been real privileged so far. Dr. Arora has had a great track record of bringing in distinguished speakers and esteemed persons, and so that continues today. And we're very glad that you joined us. The situation in our state right now is fairly similar to where we were last week. It's possible that we may have had a plateau in terms of the number of cases and hospitalizations, but that plateau is not at a good place. We have really significantly high numbers of people in the state. For about the last 8 days in a row, we've had hospitalizations in the 2,800 range, between 2,800 and 2,900. You know, we just barely got over 3,000 inpatients on a day or two back in January. So we're almost at that number. And we have been stuck at this number for some time. Like we see almost always, unfortunately, when you have high numbers of hospitalized patients, you also see a significant number of deaths. And we've had double-digit numbers of deaths being reported to us for a couple of weeks now, more than 2 weeks, in fact. And so Alabama is now well past the 12,000 total deaths mark since the pandemic began. Even though we've not quite reached the total number of inpatients that was our record, we actually have more patients requiring critical care than we have ever seen before. As of this morning, we had 91 more people in Alabama hospitals who were receiving ICU care than we had ICU beds available and licensed in Alabama. So we're at a negative 91, and that's just a terrible situation to be in. That means those patients are getting ICU care, but it's not in an ICU. It's in an emergency department, or they're on a gurney in the hallway, or the hospital has had to create some space somewhere where they normally don't provide critical care. So that's really a difficult situation to be in. Our hospitals are still very, very stressed. Our doctors and nurses and people working in the hospital have been doing this now for over a year and a half. And so it really is a difficult situation that we find ourselves in. We do see one bright spot in a way, if we could call it that. We are seeing people finally show up to get vaccinated, and that is a bright spot. We wish it hadn't taken so long, but I do think that when people have a personal experience, when they see people that they know in the hospital, when they have family members who are getting sick, maybe that's what it's taken to motivate them. Perhaps people are motivated by the fact that the Pfizer vaccine was fully approved by the FDA this past week as well, and so we're very excited about that as well. But we have seen that Alabama is now one of the top 5 states in the country in terms of percentage increase in people getting vaccinations. In terms of people receiving their first shot, at least one shot, we're ahead of about 7 other states now, and that's actually not great, right? But it's a lot better than we've been all along. So we're very glad to see ourselves there. So that's really all I had, Dr. Arora. Be glad to answer any questions, but let me turn it back to you.
Okay. So I guess, Scott, you were mentioning earlier that there was one more federal team coming into our state. Is that correct?
Yeah, that's right. We're actually excited by that. Besides the federal team that's come to Baldwin County and to Houston County, we've been approved for another one in Dale County, and we've just learned that they are planning to fill that order, so to speak, and bring a team to Dale County, to the hospital there. That's always subject to change at the last second. Just like the previous team, they're actually sending active Department of Defense troops. They're sending, in this case, medical professionals who are Navy. The team that went to Houston County were actually active Air Force. And that's just because there aren't providers in the private world out there that are available. Normally HHS would go out and hire people on contract, and there just aren't people out there available. So we're actually getting active DoD troops, and we're very happy that they're coming to Alabama.
And the number of monoclonal antibody centers currently, do you know the number?
Yeah, the number as of this morning was just past 200. And we talked about this last week. We've actually added more than 50 providers just in the past week. We were at 151 or something like that this past week, and we're just over 200 this week. So that's actually very encouraging. We have a couple of different private vendors that were referred to us by the feds who are negotiating with hospitals and some other sites around the state. We hope to have some larger sites available that are run by these private organizations once they can work out the details. But we do have them in the state working with some of our hospitals and other facilities. So we hope those numbers will continue to increase. Just to remind people, monoclonal antibodies can greatly reduce your risk of serious illness or needing hospitalization as long as they're given early. They're not for every single person who gets infected, but for those people who are at high risk because of their age or because of chronic medical problems. That actually, unfortunately, applies to a lot of Alabamians. And so they have to be prescribed by your doctor or by a doctor. So if you are infected, please talk to your doctor as soon as possible. If you don't have a doctor, please contact an urgent care in your area as soon as possible and see whether you might need to be referred for a monoclonal treatment.
I think those are two really important pieces. One, of course, the vaccine rates that are going up higher, but also the monoclonal antibodies, because as you said, with the negative ICU capacity and the hospital still seeing non-COVID related emergencies, the only way that we can do all of this is to really make sure that we let our patients know that the monoclonal antibodies are a tool it's not the tool forever to keep COVID at bay. That is the vaccine, but it is, what can keep them from being seriously ill and going to the hospital. Thank
Absolutely.
you. Thank you for that update. Dr. Landers, you want to give us an update?
Sure. Thank you, Dr. Arora, Dr. Mackey, and Dr. Harris for allowing me to be with you today. Just to speak as a pediatrician about this, I have significant concerns about the numbers of cases that we're seeing in children in the state of Alabama, and recognizing that our data shows about 24.8% of our cases in the last 4 weeks are pediatric cases. And just a couple of things to be aware of there. I think that last year, persons somehow understood that most kids did well with COVID-19 and didn't appear to have to be hospitalized. But when we look at some of the information more recently, and we look at some of the national data, one of the things that we are seeing in children is that at least 6 to 10% of kids may have long COVID. And by that, I mean perhaps problems in terms of brain fog, ability to concentrate, sleeping issues, fatigue, and some other issues. And I've mentioned those specifically because we're talking about kids needing to go to school and needing to be in the classroom and needing to be able to concentrate. So when we think about COVID from last year and we think about what's going on this year, this is not your same virus. There's a lot of difference in terms of the transmissibility. Now, whether we see the severity being worse yet, we don't know, but it certainly is much more transmissible, therefore more cases. And I say that to lead into reminding parents that all of us want our children to stay safe. And one of the most important aspects of staying safe in this pandemic is trying to prevent your child from getting COVID. Really a few things there. First of all, vaccinate your child 12 years and above. There's a lot of data on this. You can see some videos that Dr. Kimberlin has done with UAB at Children's Hospital, and also follow the mitigation standards. Again, mask, social distancing, respiratory hygiene. I realize there has been debate on this, but let me just put it in the words of Pete Pappas, who is a great infectious disease doctor and someone I went to school with. Masks work. So, let's use those. One other thing just to mention as we're talking about schools here is persons with COVID-19, children with COVID-19 need to isolate for a full 10 days. That means not go to school, not go anywhere else. Isolate for a full 10 days from the time of onset of symptoms, or if asymptomatic, from the time of test. The reason for this being that we certainly don't want kids transmitting COVID to other kids around them. That is extremely important. Again, kids should not be in school if they have COVID-19 disease. And I also want to mention the situation in terms of close contacts and home quarantine. Now, we have definitions of close contacts, and I can certainly talk about that later on. I don't want to dominate too much time here, but to be aware that if you are defined as a close contact, if you truly are a close contact, if you live in the house with someone with COVID-19, or if you've been closely associated with someone with COVID-19, then certainly your risk of developing COVID is clearly there, and especially if you're not vaccinated. And just looking at some of the studies from last year, we were seeing situations where in households, you could have between 20 and 40% transmission within households. Some kids spend as much time with their school peers and their school friends as they do in their own household. So again, if you're a close contact, you need to remain at home for the specified time of home quarantine. And again, in Alabama, we allow 10 days for home quarantine as the ability for us to probably catch kids most likely in the time that they're contagious, but also recognize that 14 days remains preferable due to the incubation period. But again, there are some elements that we can adjust to 10 days of home quarantine. Quarantine, again, is not only for the protection of other people around this contact, but also for the awareness and protection of that individual child, so that child can be monitored for potential signs or symptoms of illness and be appropriately managed and assessed. So I know we'll talk about other things, but that's really the concern that I wanted to start out with in this discussion. Thank you.
I think that's really helpful to clarify. I feel like there is a lot of confusion regarding some of the material that you just covered, in particular with the quarantining and what exactly that entails. So, with any public health situation, whether it's, tuberculosis, whether it's head lice, we do follow our public health guidelines. And I think, the guidelines that ADPH and CDC have set are certainly what we would like to continue to follow so that school can continue to be, in session and not disrupted, like unfortunately we have seen. All right, so next, Dr. Mackey, do you want to give us an update on schools?
Would be glad to do so. And again, thank you for the invitation to be with you today. So I'm not a medical expert, and rely on you guys for that advice. And really appreciate the work that's been done. Dr. Landers, Dr. Harris have been excellent partners, and their whole team for now going on 18 months, over 18 months, I guess. It's definitely been a struggle for our schools. And we're, I think I was quoted last week and a lot of people picked up on it, but I said it's getting more difficult by the day. It is still getting more difficult by the day. We're hopeful that things are soon going to turn and the numbers will become more manageable. But I'll mention just a couple of things. Certainly appreciate all that's already been said, but I was making a few notes specific about our schools. So our public K-12 schools, we have about 1,500 schools, about 720,000 students. As you know, when we started this school year, our plan was to return all students to in-person instruction 5 days a week. And that is exactly what we had intended. In fact, everybody pretty close to did that the first couple of days. We anticipated that by the second 9 weeks, end of September into October, we would begin to have breakouts. And I know that's what we in public health had talked about, is how we would handle those breakout situations. And we were thinking it would kind of be, all hands-on approach to try to stamp out those breakouts. But as everybody knows, this spike ended up hitting us as the perfect storm, because the spike came just as schools were opening. And so we had, students, we had literally dozens of students sent home on the first day of school, and then more and more. So as you probably know, now we have scores of campuses that are closed to in-person instruction. We are over, I think at the end of this week, we'll be right at 90% of schools requiring masking. Trying to do our part as best we can. That remains a local board decision. I think I'll say that again. I know it's been said over and over and over, but we don't have the authority from my office to mandate that. But most local boards, many of them started, as you know, it's been really controversial. Some of them tried to hold off and said, we're going to wait till we get to a certain number. But the vast majority now have gone ahead and done masking. And in fact, some of the ones that lifted masks have reversed their decision and gone back and done it. So the vast majority of our students are in schools where masks are required. We are still getting a lot of pushback from parents. If folks are out there listening on this that disagree with that, I would just say, please be patient. Please be patient with your local school folks, because they're doing the best they can in a difficult situation. We're still obviously really, really pushing for vaccinations. I've also gotten a lot of hate email over that, and I know, I'm sure Dr. Landers, Dr. Harris have, and others have too, but that is long term. I think the only way we get out of this is to get many, 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 many more people vaccinated, including children over 12 if they qualify. And so just in every instance, we're begging people, please talk to your pharmacist, your healthcare provider, about getting the vaccine regimen started. It's good news Dr. Harris gave us earlier that the numbers are ticking up. Now, I was making some notes. I missed it if he said it, but I don't know, our pediatric numbers were way behind the general population. And I think they still are. They may be getting better, but we still have folks not taking their children to get vaccines. So we're hoping that changes. I want to mention, we do have our dashboard up and running with ADPH. If you go to, I know you can access it from ADPH's website, but if you go to our website, alabamaachieves.org, and under the community tab, go to COVID-19 dashboard, and you can see a little more information, because we have obviously the COVID update every week, how many schools have reported and the number of positive cases they've reported. But then below that also, we're keeping up with which campuses are open for in-person learning and which ones are virtual only, or some mix in between by school. So that is also being repopulated daily. We now, again, I haven't gotten the count today. I haven't looked at it, but I mean, it's literally thousands and thousands of students have moved to remote learning. We're doing it a little differently this year though, because last year when we went remote, most districts went remote for 9 weeks. We are, for the most part, trying to avoid that and going 2 weeks, and then we'll come back at the end of 2 weeks and see, how things look, because we do know this, the most important thing, I have to say this first, is obviously the health and welfare of our students. No question. I had a correspondence with a parent today, and I had to reiterate that, like, that has to be our top priority. And second, right close behind it's academic achievement. We know, we have our state testing data back. There are a lot of things to go into that, but not surprisingly, I can't show the scores yet because they're still embargoed, but they're going to be down. And I mean, if they went up, I would be really shocked and say, well, what is it that parents are doing at home with their kids that we can't do in school? I mean, they're going to be significantly down across the board. And that's what we expected. It's what we predicted. And we hope that we can turn that around this year. And I can tell you, we had great plans for how to turn it around. But as Dr. Landers and you, Dr. Arora, have already said, as long as we're in this state where we're having to close and open and close and open, and even when we are open, there are literally hundreds of students that are at home quarantined, then we are not going to be able to really institute plans to remediate that unfinished learning. And so, you know, I go back to just pleading with people to follow those mitigation strategies and help us and be patient. You know, I get, and I'll wind this down, but I get calls every day, and I know that my colleagues at Public Health are getting these calls too, but, you know, people that screaming at school nurses, screaming at their principals. We've had some of our employees have had to have police protection now because of the way the threats that have come at them. I mean, that, you know, folks, it's a civil society, and we're all doing the best we can. Just be kind to your teachers and your school nurses, your public health nurses and officials. We're all trying to get through this, and we'll be better off if we get through it together than those kind of behavior. And obviously, the vast majority of people are patient; they're working together. But I will say we did not see that, but very little of that last year. We're seeing much more of just kind of the frustration spilling over, and I understand that. But you know, it's like when there's a holdup in the checkout line, just try to be patient. Try to be patient, because we will get through it. And I think that's all. I will go ahead and pass it back to you, because I know we'll probably have plenty of questions. But just remember that website is being updated. The COVID dashboard's being updated weekly. Those new numbers went up today. I don't know if Dr. Harris and Dr. Landers have seen them, but we had 94 campuses reporting and over 9,000 positive cases in the past week in our schools. Now, some of our schools did not report. That could be because they had low numbers, and it could be that I don't know. There could be a lot of reasons they didn't report. Some of them are actually all remote, I think now, so they didn't have students on campus. But you'll see more and more campuses reporting. So we know that the numbers are really high. If there are 9,000 reported in school, and those are students and faculty staff, and we know that some of our folks are actually, they're closed, so we can assume that there are other infections out there that didn't get reported back to the school. Oh, can I say one other thing? And I promise I'll lie down. But please also, folks in the community, if you have a positive test, call the school nurse and tell us. So we get reports pretty regular also that students are having minor symptoms, or maybe they're a close contact from church or whatever. For whatever reason, the parents take them and get them tested. The test comes back positive, but they send their kid back to school anyway and don't notify us. And I would, again, beg parents, please don't do that. If you know your child, if you suspect your child has COVID, please take them and get them tested. And if you know they do, if they have a positive test, certainly call the school nurse and do not send them back to school. I can't verify that that's happening, but we're getting regular reports that it's happening. And so there's a good chance that it is happening. And obviously that just makes it more difficult on everyone else. So thank you. Thanks for having me today.
Absolutely. We thank you for, this long, almost 2-year period. I think when this first started in March of 2020, I remember you said, the first and foremost thing that we are here to do is to, look out for the safety and the well-being and the health of the students. So I think there's a lot about the Alabama law that I think I've had to learn, in terms of, local school boards versus statewide, and all of that kind of stuff. So we're obviously very limited in what we can do by law. But ADPH has certainly made it extraordinarily clear in their toolkit the kind of things that we need to do in the midst of this surge to protect our children. And so I'm really happy to hear that 90% of our schools now have our children in masks, to help try to prevent as much as we can from spread. So
if I can say, Dr. Roy, this would be a good time to, if you don't mind me jumping in. Dr. Mackey, you've been a tremendous partner for us. We really appreciate you, and personally, I appreciate you personally, but we really appreciate working with your department. You guys have been great, and of all the people in the state of Alabama, I think you have the most impossible job, and don't know how you've been doing that. You know, you just, we're at an unusual time in history. You know, the whole country is so divided, not to mention just the state itself. And, you know, every decision is going to, you know, totally set off, you know, a certain group of people. And yet you're really doing that with a lot of grace and dignity. So thank you very much for that. And thanks for the great partner you guys have been with us.
Sure. Well, we can flip sometime for who has the most difficult job, but some days I think I do. Most days I think you do. So, but I appreciate it. It is.
Well, I think the three of you up here are certainly fighting some battles, you know, but you're directed for the right reasons, the well-being and the safety and the health of our people in our state. And I just really want everybody to remember that. So, you know, it takes all of us as a community to make these kind of things happen. So we really do rely on all of the values that we want our students to learn in school, you know, to be citizens, you know. Dr. Mackey, I think you were a science teacher before all of this.
I was.
So I think all of us here believe in science, you know, and we really are just hoping for the right kind of things to take place when we have the knowledge in front of us. It's a shame to watch lives, you know, touched and lives lost when we can do things to help keep everybody, you know, safe. So thank you all. Okay, I'm going to go to some of the questions here in the chat now. We've got a question. Okay, what can you do to get school system? I guess this is for Dr. Mackey then. What
Sure.
can you do to get school systems to have clear and communicated procedures for reporting cases so that parents are encouraged and know clearly who to report to? And I guess maybe Dr. Landers too.
Yeah, I'll start and then I'll pass to Dr. Landers. So it is, first, let me say this. I recognize that it is a little more challenging this year. Last year, we had some statewide protocols in place that we could all follow, and we had, you know, we don't have that this year. So for instance, we don't have, I know one of the reasons I feel certain, I won't question the ins and outs of it, but you know, we're pushing parents to send their children to school in masks. School boards, now most of them have mask mandates, but then I get the constant barrage. Well, you know, schools are school the only place you can transfer COVID because people go out. I see people at parties and at church and at this and at that, and they're not wearing a mask. So why do they have to wear it in school? Well, you know, I mean, I don't know what to say about that. We can do what we can do. Better to wear your seatbelt 50% of the time than not at all. Best to wear it 100% of the time. But anyway, it is more challenging year, and so part of that is local districts have different ways of they're doing things. We know that contact tracing has been an issue, and let me deal with that just the best I can. Last year we were trying to do, and I think did a pretty good job. We got a lot of reports that people weren't doing it right in places from time to time, but trying to really stay on top of contact tracing. But remember that the majority of our students were not on campus. And this year, what's happened to us is the majority of students have come back, including some high needs students that have feeding tubes, students that have taken our school nurses and our school administrators. Their time is just differently shifted this year because so many more people are back. And so it's been much more difficult to do that. And so you see some districts that have more resources are probably doing a better job of it. And I'm not going to call any out, but I mean, I just understand it. It's just difficult. And I know that's frustrating for the folks on this call. It's frustrating for parents, but I can't tell you what that person in their school district, if they don't know who to call, like if a child's positive, I mean, in most places, it's going to be the school nurse. We know we have some schools that are sharing nurses, who actually have plenty of money. It's the only time I've ever been in a situation where there is plenty of money and not enough people. We have plenty of money to hire nurses, but no applicants for open nurse positions. But you can always go to that school principal and make a report to them. We are getting a lot of reports on people too. So for instance, I mean, we get regular calls, you know, I know that Johnny is positive, but his mama sent him to school anyway. And we try to, now we have a section in our department that follows up with the local school board if that's reported to us. And we follow up on those as quickly as we can. I'll tell you that many times what we find out is that it's not true. So Johnny didn't get a positive test. Johnny's sister did, but Johnny's been vaccinated, and so doesn't technically have to quarantine. So sometimes we chase it down, and it's just a rumor. We spend a lot of time chasing those down. Sometimes we found very few where, yes, it's true that the parent just didn't, you know, they sent them to school. But most of the time, we're trying to stay on top of those as, you know, as diligently as we can. And I think that's probably the best I could answer the question. Dr. Landers, I know a lot of these superintendents are calling her for advice on a regular basis, and she can probably say a little more about the medical, how to handle that.
Thank you, Dr. Mackey. And I think this is an appropriate time for us to remember all the hard work that the schools have put in, and also our school nurses. I mean, our school nurses this past year did a yeoman's job, and they continue to work as hard as they can to meet the challenges. But right now, with the situation that we're in, we need everybody rowing in the right direction and in the same direction. And I think this gets to the heart of what Dr. Mackey said. And I also want to remind something that Dr. Harris has said many times before. COVID-19 is a notifiable disease in Alabama, as there are other notifiable diseases. And under the notifiable disease rules, there are certain requirements that diseases be reported to the health department within a specific time frame. Again, COVID-19 being intermediate and being one of those, it really needs to be reported in 24 hours. Now, recognizing we may get multiple reports on one patient, but we're getting about 5,000 reports a day. So obviously that is far more than we can investigate. But again, we may get a report from a doctor's office, but that may not generate a case in our system for a period of time. And again, we can't investigate every case. So we also rely upon parents to notify the school nurse. Again, the school nurse or the principal, they're both mandatory reporters. They are required to report using the report card. Anyone who wants to go to our school guidance, you can see information on how to provide information on the report card. The school nurses know how to do that. They do that very well. But there could be instances, again, where if a child gets a positive test at an urgent care or even their physician's office, and those entities who are also mandatory reporters put that data in as a case, but if the parent does not let the school know or let the school nurse know, and in a situation where the parent may misunderstand and believe that, well, my child just has a slight case of COVID, so they can go on to school. Again, this just perpetuates the problem that we have. So if your child is positive for COVID, they need to stay at home for the period of isolation, for the protection of the children around them. And again, in terms of standard protocols, notifiable disease rules in Alabama have not changed. Schools are still required to report. Doctors are still required to report. Other entities are still required to report. But with the volume we have coming in, we all need to work together and come together to protect the children, and also to protect the people who take care of our children, our teachers, our school staffs. We want to keep our schools open. But if we have situations where kids keep coming to school and they have COVID, then we're not going to be able to get this under control. Thank you.
Yeah, no, that's a great point. I mean, the sustainability of keeping schools open relies upon everybody doing this. You know, if we don't have enough teachers, we can't run the schools. If we don't, you know, so on and so forth. Okay, here is a question. Our school system has not communicated clearly how parents should communicate when their child is positive, i.e. email teacher, call nurse, call office. Our school system has plenty of resources. Can you direct school systems to communicate how parents should report when their student is positive? Maybe the action we need to take is to ask for a clear and transparent reporting process, such as, if your child is positive, please report to the proper person at each school. This allows us to contact trace and effectively protect our students.
Yeah, we'll, I'll commit that we'll follow up and do that. We've actually have done that, but we send a weekly communication to superintendents and we will reiterate that next week, that they have to have clear reporting procedures. And I think in their defense, I think they probably have clear reporting procedures in their plan, but it sounds like in this case, they may not have communicated that back to the parents, which is important. And so we'll make sure that happens. Now, to be fair, it's going to be different in different places. So in some places that may be called the school nurse. In other places, it may be email the assistant principal. But in most cases, I think it is they want the person to contact the school nurse. But we will, next week, we will turn that around and make it clear to folks that they need to let every parent know what those communication procedures are. Thank you for the question.
Okay. Thank you for answering. Okay, so what is the current recommendation from both the CDC and the Academy of Pediatrics regarding masking for preschools? Initially, it was for age 2 and above, but a subsequent communication from AAP said above 2. Dr. Landers?
Well, and again, I'll speak to that not only from the standpoint of what CDC and AAP say, but also from the practical standpoint of not only many years of pediatric practice, but also having my own 2 children and recognizing it. And I know other people on the panel also have children or grandchildren. And obviously we have to train our children a little bit about these masks and work in a situation where they see this as part of their attire, for lack of a better word, and just also making sure that they are not singled out or treated differently or bullied, if they're wearing a mask and perhaps other people are not. So, with that preface, let me say as a pediatrician, when we look at what the AAP has said and also the CDC, we still have the information age 2 years and above. But any of us who's ever dealt with a 2-year-old recognizes that if they don't want to wear a hat one day, they might take it off. And also the same thing about a mask, they might take it off. So I think we can be more effective in working with children in a little bit older age group. But again, 2 and above, if children do not have a medical contraindication to wearing a mask, 2 years of age and above can wear a mask, but we do recognize that compliance issues are a bit more of an issue in that age group just because of the developmental stage of that child. And also recognizing when you're telling kids to keep their hands away from their mask, well, that's about like telling kids to keep their hands away from their mouth. It's not going to happen. So I think with younger kids, we have to do the best we can in wearing masks, not only effectively, but safely. I mean, obviously ensuring that we are not in a situation where a child could, be playing on a gym or something and get tangled or anything of that nature, but more specifically continuing our hygiene practices and also distancing to the extent possible, recognizing that that's also a bit of a challenge in the 2 years and above. And Dr. Harris, I don't know if you had anything to add to that, given the fact that you have.
Sure. I don't think I can improve on that answer. I'll just say to just kind of reiterate what Dr. Landers was saying there. These are my words, not her, but masks aren't magic, and we get that. But masks are a really safe, cheap, simple, non-bothersome way to mitigate spread of disease. But they shouldn't be the only thing either. As Dr. Landers just said, it's just one of our strategies. I don't know why that one strategy seems to set so many people off. Nobody's out there sending me hate mail over us telling their kids to wash their hands, but that's also part of our guidance. And, trying to space kids, as far apart as you can reasonably do is an important part of our strategy. Again, for some reason, nobody's up in arms about that. But, masks, for some reason really seem to trigger some people. But, it's all of us doing the best we can. None of those strategies are perfect. None of those are 100% effective. The vaccines, for that matter, aren't 100% effective. But I think we all ought to just use our common sense and use every tool that we have available to try to keep kids from getting sick. And, and adults and educators in the classroom, for that matter, also, not just kids. So masks are just one part of that. They're a very important part of that, but they're just one part of that.
I think that's a good statement. Last year we had so many mitigative measures in place with a virus that wasn't nearly as contagious, nearly as infectious, and, didn't impact children in the way that this Delta variant does. So I think this is probably not the time to loosen up any of the layered approaches to what we're talking about. Okay, so this question, since there are no vaccines for children less than 12 years of age at this time, are monoclonal antibodies used for this age group, especially those at high risk of complications, or I guess their question is whether there is a weight-related dosage like other medications in the pediatric population.
I can take that question unless Dr. Harris, you want to take it. I can start off on it because I think this is a very important issue for me as a pediatrician to remind people that the therapeutics in children are limited. And while the emergency use authorization for monoclonal antibodies does allow for children 12 years of age, 40 kilograms or greater, to be candidates for monoclonals, I have had conversations with infectious disease doctors and also have looked at some information from the Pediatric Infectious Disease Society just to remind people that really in terms of utilization in the 12 to 17 age group, we absolutely have such limited information that this potential therapeutic needs to be undertaken on a case-by-case basis and not as a matter of routine therapeutics. Again, we just don't have enough data in this age group. And it's very, very important that we as pediatricians communicate that to the general medical community as well as our pediatric infectious disease specialists. So again, while the EUA is there, and while the weight range is there and there is some guidance related to certain underlying conditions, for example, persons with neurologic conditions or perhaps even genetic disorders or pulmonary or cardiac disorders, even in those instances, the Pediatric Infectious Disease Society, and again, having specific conversations related to this and just reviewing an article on it, says, look at this on a case-by-case basis and really consider consulting with a pediatric infectious disease specialist before undertaking monoclonals in this age group. Thank you.
Okay, thank you. Okay, so a question. Would you mind offering advice for how to treat school-age children who test positive for COVID? For example, what over-the-counter medications are okay? And when should patients take their child to a hospital?
Well, I think the scope of what we're talking about here is probably not for me to give specific medical advice, but to remind people to please check with their medical home and their medical provider as very general information that we speak about in terms of children who test positive for COVID. If a child tests positive for COVID, really, again, the parent needs to speak with their medical provider over the phone, their medical home over the phone, and get instructions from your doctor. I mean, obviously, we want to keep fever down with appropriate fever control medication and appropriate doses of that fever control medication. We want to keep the child hydrated with fluids. I mean, obviously, again, depending on whether or not that child has any nausea or vomiting, again, that's where we want the guidance of the medical home to come into play. Does that child have underlying medical conditions that could cause the problem to be worse? In other words, are we talking about a child that has an immunosuppressive condition, a child that has potentially had an organ transplant? I mean, we have kids now that have a lot more diseases that are even in school and being taken care of, as opposed to when I was a young doctor, when children with severe chronic diseases did not always do well. So if we have another underlying health problem, and again, just reminding parents to, if your child is sick, if your child is positive for COVID-19, talk to your provider, keep your child at home, follow the advice of your provider related to the home management of COVID-19. And finally, follow your infection control procedures. Obviously, there are times that, we cannot, in a situation in our home, especially with younger children, have the children separated from other family members because the child has to be monitored, the child has to be taken care of in terms of food and nutrition and all the other factors there. And also the child has to be kept safe. Thank you.
Okay. All right. So this question is for Dr. Mackey. Should students still continue to participate in school activities like sports if they are learning virtually because of a quarantine?
If they're, now I may have to pass that to the medical folks. If they're in quarantine, my understanding is no, they should not be participating in sports. If they're virtual learning, now we do have, so let's say, let me give
They
it,
are just learning virtually. I guess
yeah.
there's a little bit of confusion here. So
they can do that. So there's we went through this last year. Let's say, let's say the high school says, look, we're going to close down for 2 weeks because we have so many positive cases, or we don't have enough cafeteria staff to keep the school open. But they may continue to have sports practices and to have games. Now, if they're quarantined, no, they should not be participating. But if they're well and they're just doing their classes remotely, then we have no rules against them continuing to participate. I don't think there'd be any problem with that as long as they were well and had not tested, not tested or been in close contact.
Does the AHSAA work in conjunction with the schools for this, or the ADPH? How does that work?
Yeah, we kind of all work together.
Okay.
So the High School Athletic Association has put guidance in place for indoor events for the member schools. So those would be public schools and private schools, by the way, that are members, as far as basically the same strategies, masking, trying to maintain social distance as much as possible. But fortunately, in the fall, more of our activities are outside. So we have football, cross country, and volleyball. Volleyball is obviously the one that's indoors. Football is the big gatherer. I will say, outside events don't require masking, if I understand it properly. But now we still, there's no question, if you put 1,500 people shoulder to shoulder, as tight as they can be, walking over each other in the stands, they still could transmit disease. I defer to Dr. Landers or Dr. Harris if I'm wrong about that. So we still think people need as much as possible to follow mitigation strategies, even in those outdoor events. But now for our student athletes, what we learned last year, and we've got a lot of those same things in place, like for instance, when they're riding back and forth to games on the school bus, wearing masks. So we're doing a lot of things to protect our student athletes. We have a lot fewer rules for the audience. And so, because, it's just like they're all in the stands. So that comes down to some personal responsibility. But for student athletes, and not just athletes, band members and others, we are doing as many things as we can to try to keep them safe and to keep disease from spreading among a team or from one team to another one.
So the audience part, is that something that is the responsibility of, like, say, the school that the game is at? Is that usually the way that works?
That's exactly right. So for instance, if my high school is requiring masks and yours is not, then when we come to my high school to play, we have to follow my high school's rules. But now, I could be wrong about this, but I think the High School Athletic Association has said for all of their athletic contests, the masks are going to be required, even if they are in a town or a school that would not otherwise require it. So I think for their sanctioned events, it's required.
Okay. All right. Okay, so a question. Some schools are refusing to give a virtual option and will not mandate masks. What options do those parents have other than pulling them from school?
They're not giving any virtual options. So I'm out. No, that may be one where you need to follow up with the school district or with our department if they want to contact Assistant State Superintendent Terry Roller. He can try to help work through that. Obviously, I'm not going to question this caller. but most of our schools are offering some kind of virtual option. I know many of them said that you had to sign up for the virtual option like in June so they could do their scheduling, and they closed the window, but most of them have reopened the window because of the seriousness of this spike situation. They are not required, I will say though, they are not required to offer virtual option except in high school. Now that's state law that everybody has to offer virtual high school courses. They're not required to do it in K through 8. Last year, we procured a federal grant at State Department level, and we purchased virtual courses for them. Some districts used it, some districts didn't, but everybody had the option to use it, so everybody had an option. This year, going into this year, we made it clear we were passing that responsibility on to the districts. One, the grant ran out. We didn't have that money anymore. So most of them picked it up and did something locally. Now I'm gonna go to the next part. So if they say, absolutely, you want a virtual option, for say your elementary child, and your school district does not offer a virtual option, there are 5 approved online academies that are Alabama school systems. They're run by Alabama school systems. There's and I don't want to, I'm going to miss them if I name them all, but there's one by the Eufaula City Schools. There's one for Limestone County. I think there's one in Athens City, one in Chickasaw, and another one somewhere. So those are online schools that will enroll students outside their district because they have out of district enrollment policies. And again, if you contact the department, Mr. Roller can help, get those. We don't encourage, we don't want to be in the business of stealing students from one district to another. If you do that, you lose the opportunity to participate in sports because you're actually withdrawing from your local school and enrolling in a different school. But there are opportunities for everybody somewhere. We can help you find an opportunity.
Okay. And then there's this question, what is the proper way to report parents who are not reporting positives to school? School is not contact tracing and notifying parents of close contacts. School is not properly contact tracing.
Well,
yeah, Dr. Harris, I'll let you answer.
I'm really sorry I made a sound. I was hoping you were going to take that one.
Oh, well, the short answer is you need to report that to the superintendent's office. Yeah. If you know that parents are sending their kids to school sick or whatever, report it to the superintendent's office. I hope that's not as big a problem as I think it might be. But I think that many people, I think it may have been Dr. Landers who said that people might be sending their kids to school because they just have like a little bit of COVID. I'm probably paraphrasing what you said, but it's not like having a head cold but not running a fever, and we've in the past, we've had the rules always been around fever, right? Fever, vomiting, upset stomach. If you were sickly, you had the sniffles, but if you were not running a fever and you were not throwing up or had diarrhea, then you could come on to school. But that is not the case here. If you're COVID positive, even if you're not running a fever, obviously we need you not to come to school. And I think that some parents are confusing that. And I think some parents just feel like their back's against the wall. They may need to go to work. And so, Sarah doesn't have a fever, so I'm going to go ahead and send Sarah to school and hope she doesn't get caught. And that's, of course, not helping us in the long term.
I would say, and people certainly reach out to public health as well. We encourage that as well. If we know about those cases, we'll do our best to help. I couldn't agree more with Dr. Mackey. I don't think that there's, a lot of parents out there just scheming to do the wrong thing. I think parents have just been in a really tough situation for 1.5 years. And if you have a child who just seems well and there's nothing wrong with them, even if they, have tested positive, I think parents are trying to, weigh out the pros and cons there when they really, really need to go to work and so on. So, we understand the motivation, but it is important that we keep kids who are infected out of the classroom because we don't want to put other kids at risk or educators at risk. So again, as Dr. Mackey said, reach out to those school officials, but certainly you can reach out to us as well, and we'll do our best to help with that.
And Aruna, Dr. Arora, just to follow up on what both Doctors Mackey and Harris have said is that, I think we have to look at it, and again, we're all parents, so put ourselves back in the shoes of where parents, where we were at that time, or where some of us still are, because, again, there are people on this board who still have children in the school system, but keeping in mind that it's ongoing information and education, and really helping parents to understand, for example, that asymptomatic case of COVID can certainly transmit COVID to other children. And the situation where the child is, again, slightly affected at the moment, but appears to be well enough to go to school. And what I remind parents under those circumstances is, yes, I see you're in a tough spot. I understand you're in a tough spot, and we're all having to fall back on our different contingency plans for taking care of our children. But let's turn it around. What if you were the parent who had your well child in school, or your well children in school, and another parent made that decision? Well, I'm just going to slip my kid in. I'm just going to send my kid on to school. How would you feel about that? And I think this is where we have to keep looking at not only how COVID affects we as individuals, but also how COVID affects the people around us. Well, if I get COVID, I'll be fine, or my kid just has a small case of COVID. But what about the transmission to other people? And it will happen depending on, the situation. I mean, obviously the risk of Delta is pretty high in terms of transmission. I heard a doctor yesterday that just used a nice round number and said, you're going to infect 3 other people, but you could infect 8 other people. And I'd been using the range 2 to 8. So I felt pretty good about what these national experts were saying. But again, turn that around and recognize you want your child to be kept safe, as well as to be able to keep other people around them from spreading illness. Thank you.
Thank you. Lastly, does one of you want to mention the surveillance testing program that our state, the pilot program? Have schools been doing this, and how has it been fairly? Anyone want to give us an update on that?
Dr. Harris may have more. Yeah, Dr. Harris or Dr. Landers may have more up-to-date information than I do, but that's a project we've worked together with Public Health and UAB School of Health. I think they are just starting the first test next week, actually, but it is getting rolled out. And to be honest with you, I got a short briefing on it this morning, and we had to cut it short, and I didn't get which school districts are actually in the pilot. But we hope that will prove to be something that kind of nips it in the bud and slows down the rate of infection, and in which case we can spread that across the state.
Yeah, no, I think that would be great. I mean, I know there's modeling out there that between masking and testing, there's a real great way that you can kind of put a hold on this. So without the testing part, it makes it difficult. And I think as a parent, I know, multiple parents around me always are so confused with what kind of symptoms should make them go and get a test. It becomes really difficult when, allergy symptoms all the way to, a GI bug, kind of fall within the range of COVID symptoms. So I think what you said about not assuming the worst of people and just assuming that people are trying to do what they can do with the best of their knowledge, and just helping to increase our public health education so that people know what their responsibility is as a community member. Well, I really appreciate the 3 of you. I know we've run to the hour, so I don't want to take too much more of your time. I thank all of you for participating today on a really important topic. We obviously want our kids in school after last year. There's so many needs, not just learning, but nutritional needs that Dr. Mackey really, him and his team really addressed early on in this pandemic. And so many of the other needs, emotional needs and mental health needs that our children need by being in school. So the only way for us to do this is to really keep the quarantines down by following everything that we need to. If we proactively do what we need to, school will not have to be disrupted. And I hope that teachers are out there getting vaccinated, and I hope children over the age of 12 are getting vaccinated. Anybody have any last comments?
Thank you very much.
Thank you very much. And thank you, Dr. Mackey and Dr. Landers, for joining us. We really appreciate both of you.
Thank you. It's a great privilege.
Absolutely. Everybody take care.
Bye-bye.